George, thank you so much for joining us in Voices of Stack. We are so excited to have you here.
No, I'm going to say it's a pleasure to be here. And what I want to say is thank you for the kind of work that you do, because every time there's organizations that help empower and uplift people, that's a win for the entire culture.
Thank you. Thank you for saying that. It's wonderful to discover such alignment. And I've said this before, if we could have more people like you in the clinical research and clinical trial world. So you have spent well over a decade in the clinical trial world between Covance and Labcorp. Why are you passionate about the industry and work? Why are you so passionate about clinical trials and clinical research? And how did you transition into the industry, and what made you interested in the industry?
Well, in 2003, my youngest son was born, and long story long, the very much a special needs from day one. First, or the week before he was due, getting the final exam, everything's looking great. Sonogram, mom's absorbed all the amniotic fluid. We're having a baby a week early. Let's go. You've got till tonight to be at the hospital. So we flexed. We went in there. And apparently that must have occurred a couple of weeks before that, because there's certain signs they can tell that that's occurred. The child is hypertonic when they're born. Jamie stood up 6 hours after he was born because his muscles were so strong, because without that barrier and buffer, everything was louder and harsher and scarier. And so he was constantly, and that whole process and what caused it, we found out had been an in utero minor stroke, which, because he was so young and was immediately put on a clinical trial drug that was out, completely healed all that, but it left electromagnetic signatures behind, and it left surprises. And so as he grew up, starting around age 2, every growth spurt was like an episode of House. There was just this whole train of events that later led to a diagnosis of stroke-induced Ehlers-Danlos. And over the course of his life, I mean, this June he graduated, and he's off to college now, right? He's going to be a forensic accountant. He wants to be the track the money trail guy, but none of that would have happened except for 16 diagnoses, 31 novel medicines and therapies, and every single one of them came through Covance and Labcorp.
Wow.
Every blood test he ever had came through Labcorp. I knew their logo before I went to work for them. And so that's why I'm there, and that's what I do. And it's just neat that so many lives are improved and touched by the fact that there's a company that specializes in cutting down the amount of time it takes to get medicine to market.
George, that story was so powerful, and I'm really glad your son Jamie, right? Your son Jamie is now off to college to be a forensic accountant. It's wonderful. Speaking of the industry now, because you've been in it for quite a bit, what are the biggest trends and changes that you see in clinical research and clinical trials? And has this past year with the pandemic, has it accelerated any of these trends or started new ones?
Well, that's a great question, because the reality around us begins to answer it. We have gotten to a place where every single company that does anything with medicine has realized that we need science at the speed of now, right? We can't have science at the speed of later. When the pandemic started, the first thing we had to do was we had to flex to as many people as possible working remote, which for every company on the planet was in some ways a revelation, in some ways a disaster. Nobody had infrastructure built to have 30,000 people logging in on a virtual private network to do work all day, every day, 24/7 around the globe. But that's what Labcorp drug development is. That's where we are. I was so proud of my colleagues in the IT space who pivoted and got us all up to speed so quickly. And then we were asked by one of our major sponsors, could you please help us start a clinical trial of a COVID vaccine so much faster than has typically been done. And we did it, and we did it by an order of magnitude. And then everybody went, hey, we want some of that. We've got one too. And so our business started really expanding. But it comes down to the patients.
Sure.
And when a clinical trial, clinical research outsourcing, they call it a CRO, when we are awarded the trust to run their study for them, they are trusting us to take care of their patients. And that matters. And when you double in volume and it doesn't stop, you have to work, think, and plan differently. And that's really what we did. The biggest problem we had was not enough tests were available, and they ramped up their capacity to deliver by unbelievable levels. And we, of course, were living in a world both of the stress of a pandemic, a political world where everything's about blame, and et cetera, et cetera. And all they did is said, you know what if we just ramped up and made the problem go away? What if we just do more? Let's not argue, let's not complain, we're not pointing fingers, let's just do more. And our CEO is a great leader in that. He's all about how can we be better tomorrow than we were today. And that's kind of the, drug development's mantra is energizing purpose. Well, I don't know what's more of an energizing purpose than making sure your neighbor can get a test and or a vaccine when they need it.
Absolutely. Absolutely. So with this crazy growth that you all have experienced at LabCorp, for those who want to be a part of this growth, who are excited about the impact and the work that LabCorp is doing, what are skills, both hard and soft, that are important for getting your foot in the door at LabCorp?
If you have developed an expertise, number one, I'm going to call it EQ, emotional intelligence. You can read your room, you can understand. So much velocity in industry can be lost if the room's in churn.
Mm.
And reading a room and having great communication skills and understanding what the expectations are that have been handed to you, and having the courage to ask authentic questions when you don't understand, those are attributes that you can encourage them, you can build them, but if they're not there, they're not there. So those are attributes that you want to be true. And if you've got those, then that's a check of a box. And that those frontline people that will communicate in an authentic, genuine fashion, that will escalate problems internally, that will not let their trial sponsors be surprised by bad news. Those are people, those attributes, whether you've worked in clinical trials or not, are attributes that win. And people that go, I'd love to work. And, I did project management for a while and it was fun, but I'd like to work in the clinical trial space. Then what they would probably want to do is become familiar with how a clinical trial runs. Mm-hmm. And what those steps and phases and things are, and then determine what role in that process do I feel like I have the most interest and aptitude for. Mm-hmm. And kind of some of the stuff that I understand Stack Education does is help match them to that aptitude and motivational fit. Because you want to take talent and turn it into technique. You want to take aptitude and turn it into achievement. And that's why, you don't necessarily have to have been in clinical trials all your life to add value. Why I was kind of interested in what Stack was doing is because you're another organization who, if you're successful, you have engaged, empowered, and uplifted thousands of people, and the world is better because those people are now going out doing important work. I mean, any enterprise that isn't doing that never been of a lot of interest to me.
I love that. Again, as you said, by highlighting your own career and your own transition in different industries, whether it's in energy or automotive, and now in clinical research and clinical trials, it's again less about the industry experience and it's more, as you said, the learning agility. Let's talk about growth opportunities in project management. And you've talked about it a little bit, but at a company like LabCorp, if someone's coming in at an entry level or junior role, like where can they go? How many different levels are there?
Almost every one of our central lab senior executives came in at an entry level position somewhere, either with us or with someone else, but they came in at that level of the industry and they worked and they moved across the different silos of expertise and moved their way on up. And in project management, it's no different. I've seen people come in and work clinical trials and project coordinating and portfolio lead, and then they're leading the team, and then maybe they would bounce over to technology for a while to do some leadership over there. Then they come back over into the labs. People move around, And that's intentional because when you get to executive leaders, you want them to understand what they're hearing from other areas. If
Mhm.
you've never been in the lab, you're never going to really understand what they care about.
Mhm.
And there are so many career paths, and all of them can go upwards if the associate wants to put in the time, the effort, and deliver with sufficient excellence.
So along this line, why should someone come work at Labcorp? Like, what excites you about the future of Labcorp?
It's always going to be at the cutting edge of technology. It's never going to be satisfied with where we're at.
Mm.
And even though science can be a transactional endeavor when you're in clinical trials, obviously, you want to get the most science processed for the least amount of stress and effort and cost. We're always looking for ways to push the ceiling, break the ceiling, and disrupt the ceiling. And people that are good at that are often fast movers. And people that are internal that say, "Put me in, coach," those are the people that you're going to pay attention to. Even if they don't get that particular role, you're going to pay attention.
That they showed initiative.
Yep.
Okay. How about this? If you could talk to your younger self, and you get to decide who, like, when this younger self is, if you could talk to your younger self, what advice would you give your younger self?
Well, I'm going to do one that's smart alecky, and then I'm going to do a real one.
Okay,
Don't put that cheeseburger in your dresser. Don't do that. Don't. When you favor, don't. No, I think the advice would be, and it's not because I didn't follow it, it's because I was right. And that is, when the window of opportunity opens, or the door of opportunity opens, step through it. Put me in, coach, because they only open so often.
Mm.
And letting things, I've had to walk away from a couple of prime job opportunities. So yeah, I would say opportunities, and pay attention to the important.
Okay, that's wonderful. And also, don't put the cheeseburger in the dresser.
Do not. Because you know what happens? About a week later, mom finds it. And then you get the Irish mom going, "This is the last time I'm going to tell you to clean up this filthy room." Well, when he regained consciousness,
Oh, that's amazing.
remember that what you're actually going to get out of an opportunity is something that makes you excited to make that leap, and be brave. And even if you stumble and you end up with one you don't really like, you can always go, "You know what? That wasn't right," and move on.
Mhm. Nothing is irreversible.
Yep.
And nothing is permanent. George, thank you so much. We've covered so much today, from sharing your inspiring story and more about your son, Jamie, as to what drove you into clinical research and clinical trials. Um, thank you so much. This has been so very fun. So
And a
thank you,
last
George.
comment to anybody watching this that's at an inflection point: the architect of your tomorrow is you. Sharpen your pencil.
Perfect. Thank you.
You're welcome.